Supplements have traditionally been used to replenish the body with vitamins that are missing from the food and to protect it against deficiencies. Longevity supplements, which work on the signs of aging and can be used in the hopes of living longer, are a developing aspect of the longevity market. Glutathione, a tripeptide that protects the body from toxins and may prolong lifespan, is one such supplement. Welcome to today's episode of Longevity News. In this episode, I will show you all of the amazing health, and more specifically mental health benefits of this super safe antioxidant. Longevity supplements vary from other types of dietary supplements in that they target the processes that regulate aging. These pathways, known as the hallmarks of aging, induce, respond to, and result from the molecular and cellular damage that the body accumulates with age. Glutathione is a chemical generated by the body that protects it from sickness and premature aging. It is an antioxidant that is present in plants, animals, fungi, bacteria, and archaea and serves a variety of roles in the anti-aging process. As a tripeptide, it combines the antioxidant activity of glutamine, glycine, and cysteine. It protects the body from free radicals and neutralizes mercury and POPs, both of which are causes of oxidative stress that may cause damage and inflammation. It also cleanses the body of hydroperoxides, peroxynitrites, and lipid peroxides. Glutathione also lowers oxidants by recycling vitamins C and E. Antioxidants are created in the body and, as the name implies, defend against oxidative stress and neutralize free radicals. They are also present in the diet, and may be found in a rainbow of fruits, vegetables, nuts, seeds, and spices. However, having too much antioxidants in the body can produce pro-oxidant activity, a phenomenon known as the antioxidant paradox. The precise threshold at which antioxidants make this oxidative transition is unknown, and more research into the antioxidant paradox is needed. Glutathione levels in the cell and mitochondria are closely related to better health and longevity. Indeed, those with low glutathione levels are more prone to acquire disorders and impaired functioning related with aging, such as hypertension and myocardial infarction are two examples of cardiovascular illnesses. Alzheimer's and other neurodegenerative disorders. HIV and autoimmune illnesses are examples of immunological disorders. Glaucoma, cataracts, and macular degeneration are all age-related eye illnesses. Glutathione has been used to treat disorders such as Parkinson's, cystic fibrosis, COPD, and even nail biting. Higher levels were associated with greater physical health, self-rated health, and fewer illnesses in older persons. Clearly, adequate glutathione levels are critical for sustaining health, eliminating pollutants, and increasing longevity. Individuals' glutathione status varies based on their body's capacity to manufacture it. In severe circumstances, low glutathione levels have been related to alcohol, chemical pollutants, and illnesses. Given that the body's glutathione production diminishes with age, as well as the stress, low nutritional meals, and environmental pollutants of contemporary life, it's no surprise that our glutathione levels might be depleted. Fortunately, glutathione may be found naturally in foods that are normally considered healthy, such as whey protein, omega-3 from fatty fish, cruciferous vegetables, and green tea. Reducing the body's demand for antioxidants by minimizing exposure to pollutants, such as alcohol use, is also beneficial. Glutathione dietary sources are surprisingly diversified. One study discovered that drinking 500 milliliters of alcohol-free beer increased glutathione levels by 29%. Glutathione can also be used orally, topically, intravenously, or intranasally. The most convenient option is to take oral supplements. However, because to glutathione's low absorption, they might have limited efficacy. Ageless RX is a pioneer in the longevity supplement market. According to Dr. Sajjad Zalzala, co-founder and chief medical officer of Ageless RX, people seek glutathione for a variety of reasons, including enhancing skin, lowering inflammation, and reducing tiredness, to mention a few. Bioavailability was a crucial factor while we were examining glutathione delivery strategies, he explained. When compared to over-the-counter, OTC, oral formulations, each of the administration modalities for the medications we provide, injections, patches, and nasal spray, stood out as the most convenient and effective. Patches and nasal sprays are less intrusive solutions for folks who are afraid of needles. Patches, which provide a low-level current for active absorption of glutathione into the circulatory system through the skin, are gaining popular. They also have greater glutathione concentrations than over-the-counter patches. Nasal sprays are another simple and practical choice, with claims of increased mental clarity and cognitive function, among other health advantages. Glutathione is a potent antioxidant generated by the body and found in food that protects against oxidative stress, which is thought to be a major cause of aging and associated disorders. Glutathione synthesis varies by individual and declines with age. Patches and nasal sprays that supplement glutathione are the simplest approach to increase glutathione levels and may have long-term health and longevity effects. Cysteine is the most significant and one of the most crucial building components in the formation of glutathione. The cysteine dosage regulates the pace and amount of glutathione synthesis in the cell. Cysteine can be supplemented by consuming 500 to 1,000 milligrams of NAC, N-acetylcysteine, per day. Oral glutathione has traditionally had extremely low to no bioavailability since it is rapidly destroyed by the gut and liver. As an alternative, some turn to IV infusions, although this is time-consuming. Patches are gaining popularity as a simple and effective technique to increase health span, and Agalesarex's iontophoresis patches are among the most popular. Furthermore, OTC patches have substantially lower glutathione concentrations. Ageless RX patches, for example, contain 200 mg of prescription-strength solution each patch, whilst other OTC patches include as low as 20 mg per patch. Active absorption allows for substantially larger amounts of absorption via the skin than OTC passive versions. Glutathione injections may appear intimidating to a beginner, but Dr. Zalzala is quick to dispel any fears. In my experience, and in the experiences of our patients, he adds, apprehension of injections seems to be more of a psychological barrier than a physical obstacle. We've found that after 1 or 2 usage, most patients are at ease with the procedure. Subcutaneous needles are about the size of an insulin needle. Aside from a small burning sensation when the solution is administered, most patients report minimal pain. It's over in a matter of seconds. Patches would be the next best alternative for people who are not comfortable with the concept of injections. Acne patients with low glutathione reserves often have higher levels of oxidative stress. Acne can be caused by reduced antioxidative activity, and a lack of antioxidants for an extended period of time can worsen skin health. Acne may be minimized by boosting glutathione levels, which stimulate skin renewal and combat oxidative stress. Some ladies who have sought out the best skincare experts have discovered that glutathione may, in fact, lighten the skin. Glutathione lightens skin by decreasing the activity of skin cells that produce dark pigments known as melanin. This action helps to reduce the visibility of darker skin patches, which tend to become more noticeable as we age. Unfortunately, high blood sugar and type 2 diabetes diminish glutathione levels in the body. As a result, free radical buildup causes a variety of health problems, including but not limited to heart problems, decreased brain health, and nerve damage. By boosting glutathione levels, several health concerns can be avoided or severely minimized. For a limited time, the kidneys can withstand greater amounts of oxidative stress. Consistently increased levels, on the other hand, may wreak havoc on the kidneys, causing everything from modest difficulties to full-blown renal failure. In a recent study, rats in the early stages of kidney illness were fed aspartame, which aggravated the symptoms. However, when researchers provided N-acetylcysteine, glutathione levels rose, preventing further kidney damage. In addition, in a clinical investigation, individuals with chronic kidney disease undergoing hemodialysis were administered intravenous glutathione, which was proven to restore kidney function and completely reverse anemia. Several investigations examined the biochemistry of persons suffering from depression and concluded that all of the subjects had decreased glutathione levels. As a result, glutathione has been proven in animal experiments to prevent depression under stress. Although restoring normal glutathione levels helps to normalize stress responses and relax the mind, It also has a good effect on other mental diseases such as bipolar disorder, obsessive-compulsive disorder, and schizophrenia. It is widely accepted that persons suffering from schizophrenia have low glutathione levels. Several clinical investigations offered N-acetylcysteine, a cysteine supplement that raises glutathione levels, to people who improved their schizophrenia symptoms. Obsessive-compulsive disorder, OCD, has been linked to higher amounts of free radicals in the blood. Increasing glutathione levels would improve antioxidant defense, stress resistance, and symptom severity. The most commonly prescribed drugs used to treat bipolar disorder are effective due to increasing glutathione levels. Alternatively, increasing glutathione levels by intravenous administration or supplementation may assist to ease symptoms and restore mood. Those with ADHD, attention deficit hyperactivity disorder, often have low glutathione levels and increased levels of oxidative stress. Current study has demonstrated that giving glutathione and pycnogenol, an antioxidant derived from pine bark extract, to patients with ADHD resulted in a reasonably quick improvement in symptoms. Furthermore, in a recent research of rats with Huntington's disease, a mitochondrial boost with curcumin, natural anti-inflammation supplement, demonstrated an increase in the health mitochondria. The major causes of Huntington's disease are mitochondrial dysfunction and chronic oxidative stress. Individuals suffering from brain illnesses and/or impaired cognitive function must give the brain with the necessary building blocks to produce glutathione and other antioxidants. When supplementing, utilize only high-quality items that have the highest bioavailability in bridging the blood-brain barrier. Increasing glutathione levels in your body is an excellent way to boost your antioxidant and immune system defenses. Having enough glutathione levels in your system will give you with full body detoxification as well as healthy support for your brain, heart, and liver. However, not all glutathione supplements are created equal, since only particular glutathione delivery formulations can prevent this antioxidant from being broken down by the liver before it reaches the circulation. So, what is your opinion and experience on taking glutathione? Have you seen any benefits from it, expected or not? Please tell us your opinion in the comments section below. I would love to hear what you have to say about it. Thank you for watching Longevity News. We consistently report on the newest biotechnologies and supplements around longevity on society's path to curing aging. Please support our cause by liking this video and subscribing to not miss out on any new videos.